Hi, everyone. Bienvenidos. I'm Desiree Berenguer Carton with your American Cancer Society. Welcome to ACS in the AM. We are so excited to welcome Dr. Tracy-Ann Moo, a breast cancer surgical oncologist from Memorial Sloan Kettering Cancer Center. Hi, Dr. Moo. Thank you so much for joining us.
Good morning, Desiree. Thanks for having me. It's my pleasure to be here today.
Well, we are so excited to be here and get some good information from you. I have a few questions. With the American Cancer Society making strides against breast cancer kickoff next week, the fight to end breast cancer is top of mind for us. So can you tell us what are the risks for developing breast cancer, and are there risks specific to people of color?
So the biggest risk factor is really being a woman. And in the United States, there's about a 12% lifetime risk for a woman to develop breast cancer. So this translates to about every 1 in 8 women having a diagnosis of breast cancer during her lifetime. There are things that can increase this risk, and those things include genetics. So your family history is a big one, and that's something most of us can't change, but that affects your risk of developing breast cancer. There are other things we often look at, such as your estrogen exposure during your lifetime. So when you started your period, when you go into menopause, and how many children you have. Having children is actually protective, and breastfeeding is protective as well. There are other lifestyle factors that we often think about as well in terms of increasing your risk. So diet and exercise, so maintaining a normal body weight is something that we can all do to try to mitigate that risk. And then beyond that, when we speak specifically of women of color, there are certain things that are different for women of color when we think about breast cancer. And that's because women of color tend to develop breast cancers or have breast cancers diagnosed that are more advanced compared to white women or even Asian women. And then women of color can tend to be younger when they're diagnosed with breast cancers and may have more aggressive breast cancers, particularly what we call triple negative breast cancers. So there are some things that are different.
Yeah, it's so important to know your risk factors. My mom is a breast cancer survivor. It's key. I know my family history, and I'm passing that information on to my daughter. And early detection prevention is so important. So I stay on top of my screenings. When should people typically be screened for breast cancer?
Mm-hmm. I have to say I agree 100%. And this is something that I want to touch on before I start answering your question. What you said about knowing your family history, that's very, very important, because that helps us to determine when we should screen you. It's not exactly as clear cut as, the guideline, which we often think of, which is starting at 40. And that's where we generally start for the average risk woman. But for somebody with a family history, we think of starting earlier. And that recommendation is usually about 10 years prior to the earliest age of diagnosis in your family.
Yeah, thank you for that. And men can get breast cancer too?
That's right. Men can get breast cancer. Of course, the risk is much lower, I'd say less than 1%, but it is possible. So we don't generally recommend screening in terms of imaging for men, as it's such a rare occurrence in men.
Sure, but that's where it is, again, knowing our family history. So thank you so much for joining us and sharing this important information, because screenings save lives. So thank you again for joining us.
My pleasure, Desiree.
For more information, please head to cancer.org/breastcancer. Have a great day. Adios.